Sarcoidosis is a rare disease that can affect any organ in the body, but most commonly apparently goes after the lungs. It's the disease that claimed the life of comedian and actor Barney. Focus at 4's Linda Mays went to the only multidisciplinary clinic in the Southeast to learn more about an often misdiagnosed disease.
It took years before John Mark Ford learned he suffered from a fairly rare inflammatory disease he's never heard of.
How short of breath do you get walking now as far as
A lingering shortness of breath and a lack of energy have plagued Ford for years.
I found that, walking up a flight of stairs got pretty rough. Just doing normal things, mowing the grass, that kind of thing, got harder and harder to do.
A chest x-ray and a biopsy confirmed a diagnosis of sarcoidosis 8 years ago.
It's basically a stimulation of the immune system to form these inflammatory clusters of cells called granulomas in tissue. It's a fascinating and very complex disease that most behaves like an autoimmune process, similar to things like rheumatoid arthritis or lupus.
Sarcoidosis most commonly attacks the lungs and lymph nodes. However, it affects multiple organs.
Patients can experience lung disease and problems with their eyes, where they have these granulomas in the eyes. Some patients have diffuse skin lesions from it. Some patients have all three of those.
Sarcoid patients get regular checkups, for example, to measure how well their lungs are working. This peak airflow meter measures air pressure from the lungs. This simple walking test in the halls of U.A.B's Sarcoidosis Clinic helps determine the patient's level of oxygen.
Walk at your own pace and let me know if you need to stop.
Ford's oxygen level is good. However, long-term shortness of breath does require treatment.
I take a huge handful of pills every morning and every night. And I think I have something like 15 or 18 prescriptions. Injections.
Some of the medications have side effects like weight gain and puffiness, but Dr. Joseph Barney says medications can work to completely disable the disease in some patients.
If a patient has an x-ray, like this patient does, where they have some enlargement of the lymph nodes of the chest, that probably will always be a finding that they have on the chest x-ray, that the lymph nodes would be enlarged. But with the right medications, their symptoms would become inactive.
But despite aggressive therapy, some patients with advanced disease will require supplemental oxygen, and some patients will die from sarcoidosis with lung involvement, like famous comedian and actor Barney back in 2008.
People used to say that African American patients in the Southeast were the most common patients who had this disease, and in fact it is seen in more severity or higher organ involvement in African American patients. But really, when you look at it, the epidemiology of the disease is still poorly understood.
Sarcoidosis affects people of all ethnic backgrounds, and Dr. Barney says most patients are diagnosed while in their 20s or their 30s. And I want to add to that, a lung transplant for some patients could be the solution.
How about that? How busy is that clinic?
That clinic is busy.
It's the only one in the Southeast.
Right, it is the only one in the Southeast. Dr. Joseph Barney, he is the premier in critical care and pulmonary care, and also including sarcoidosis treatment. The clinic is in its 6th year, and every year it sees 150 new patients.
So it sounds like that there's still a lot of unanswered questions about all of this.
That is true. However, there are advancements in medicine and the therapy. In fact, there are more medicines now other than the steroids and the prednisone, and there are clinical trials going on right now at U.A.B and other institutions, and if folks want to get involved in those trials on sarcoidosis, it is 996-5864, 205-996-5864.
All right, by the way,